Hi, everybody. Thanks for joining us. For those of you who don't know me, my name is Peter Llewellyn. I run the services at MedComms and the associated websites. So information, resources, activities, and so on for people who work across the world in and around medical communications, medical education, medical publishing, and so on and so forth. Shout out to those of you who want to join the business. We provide a lot of information for people who want to be maybe a medical writer, medical account manager, whatever, in the agencies and so on. So First MedComms job is a good website to go and have a look at. We do a lot of these webinars, we record them, we put them on NetworkPharma TV. You'll find there's now hundreds of videos over there, mostly from these sorts of webinars, but also lots of other video content as well. So there's a very good resource to go and look at if you've not yet seen it. These webinars are great because we can get people from all over the world together, and we've got a good sized international audience again, but also a good international group on the panel today. It's quite a lot of this. We're going to talk about some data that EPG have developed looking at communicating with HCPs. There's a lot of data and we've got a big panel today, so I'm going to keep as stum as I can, at least until the end. Okay, so on that note, I'm going to hand over to Ben to kick us off. Thanks, Ben.
Great, thanks, Peter. I'm really happy to be here, and we're, I think, going to get right into it. Jonathan, if you want to bring up the slides. Starting with very brief introductions, which is the first slide. So maybe just go left to right. Andreas, do you want to kick us off? Tell us all who's on the panel.
Yes, hello everyone. Thanks for having me. My name is Andreas. I'm heading medical customer excellence at Bayer globally, which really looks into the future of customer engagement. What can we do today and what do we want to do in the future?
Great. And I'm Ben Gillard. I'm the head of the scientific services team with EPG Health, who, as of yesterday, has publicly released our 2023 report, which will be doing some top-line information and giving you all a chance to download. And I'm very happy to be here discussing some of our findings and having this excellent panel kick around all the details that we'll be showing you.
And hi, everybody. It's Jonathan McDonald. I'm the Chief Operating Officer here at EPG Health. Delighted to share the report with you today and looking forward to our conversation.
Hello, everyone. I'm Gabor. My pleasure to be here. I'm a patient advocate director at Kyowa Kirin, and prior, a couple of months earlier, I work in the service provider side and I study human behavior. How can we communicate more efficiently with physicians and patients that will drive belief and behavior change?
And hello, everyone. My name is Caroline Helford. I'm the Business Development Director for IME, Independent Medical Education at Springer Healthcare, which is part of the Springer Nature Group. A big part of delivering education is really thinking about what formats, how to reach healthcare professionals, how to keep them engaged, and how to effectively improve their knowledge and confidence and competence. So really excited about this report and for the panel.
All right, and Peter, you probably need no introduction as you are facilitating these regularly, but really thank you and to the network for hosting this great event today. So getting right into it, Jonathan, if you want to go to the next slide. EPG Health has just published, as of yesterday, and we'll be sharing a link with you all, our 2023 multi-stakeholder study, The Future of HCP Engagement Impact. And this was a good number of respondents, almost 300 healthcare professionals split between Europe, Asia, North America, and the rest of the world. Over 100 pharmaceutical representatives, evenly split between medical affairs, marketing, and other departments. And finally, service providers like EPG Health, who run the medical education website MedAuthority, also a mix of medical communications, consultancies, and other. So the numbers and the top line data we're presenting to you are based on this relatively large sample size and are really showing a good, I can't say consensus because there are definitely differences across the report, but we'll be sharing some of the top line takeaways. And I encourage everyone on this call, please go ahead and download your own copy because there are a lot of details we'll be glossing over that you can get into yourself. And one final thing I should mention, there's some interesting age stratification in our report. And as I point out with the healthcare professional contingent, there's a good geographical spread of responses as well. So we can go to the next slide. So the first thing when it comes to digital, this is one of the first things we'd like to look at. Pharmaceutical companies are okay with digital now. It was the least concerning of the 15 challenges listed in our questionnaire, and it is down from 60%, considering it a major challenge in our previous report, to only 18% now. But while pharma are comfortable with digital, they're not so comfortable with the outcomes of digital. What are they measuring? What are they getting out of digital? Insights into HCP behaviors. And this really came out as pharma's #1 priority in 2024, insight into HCP needs and behaviors. Next slide. And now when we wrap in the idea of the healthcare professionals and service providers, HCPs, they appreciate the digital efforts. There was a strong 89% of HCPs reporting an improvement in the digital offerings in medical education and medical communications. But again, pharma have very low rates of measuring that success. What's the effectiveness? What's the maturity? What's the knowledge gain? How do we know it's making any impact? And service providers, on the other hand, are getting more traction per their responses in measuring effectiveness and measuring engagement maturity. So this really gets into our final slide of this introductory section before we go to the full panel. What is engagement? What really matters? And as this poll from a few weeks ago shows, engagement is not repeat users, session numbers, average session time, or much less page views. It's a holistic combination. And I would now open it up to the panel. What is that holistic combination? How do we measure engagement in medical communications, particularly digital medical communications? And how do you get the most traction in making sure what you're doing is effective?
So yeah, let me get started, man. So again, that very interesting findings, right? But you know, a lot of that is not very surprising, I would say. So we have seen that over the last years already, how that is evolving. I mean, happy to see that also, you know, pharma really caught up on the digital offerings, I would say. So we're getting better. I mean, me representing pharma also in the discussion here. But really, when it comes to measuring the impact of that, that is a challenge across the board, right? It has been a challenge for many, many years. And no one has the secret sauce. No one has really, you know, identified and a broad came to a good conclusion around that. I would say from a pharma perspective, I mean, what we are at the very end trying to achieve is we want to improve patient lives, right? So and that's always in everything we do should be our ultimate outcome. The question is, of everything we do, how close can we come to the measurement of that? But if you cannot measure that directly, what are, when we back engineer that, what are the steps that we can still measure, right? So and we talk about, you know, the behavioral change that we want to implement, you know, the clinical practice that we want to change, and those things I think need to be much more in focus of our discussions. But the point is, and that's really the challenge for us, it's hard to measure. It's very difficult to measure. So therefore, we take the easy route very often, and we go with the, you know, with the KPIs that are easy to measure: the number of events, the number of clicks, the number of opening rates, the number of all of that, right? So and that really needs to change. I think at the end, it needs to be a combination of those. We need to have still engagement data, but we need to go much more further in the direction of impact data, and need to also put more efforts into really getting more high quality outcome data.
Yeah, if I can add to that, actually, Andreas, I completely agree with you. And from the IME perspective, yeah, this graph absolutely is correct. I think we've moved way away from impacts in terms of clicks, time spent on page. I think how we like to measure impact from the IME side is really, are we reaching the right people? So not just people, but are we reaching the right healthcare professionals? Are we keeping them engaged, and are they learning? So for IME, it's quite common to use the MORS learning outcomes ladder. So it's not just, are people watching or engaging with the activities? Are they gaining knowledge? Are they increasing their competence in treating patients? And ultimately, going back to these healthcare professionals months afterwards to track, you know, are they changing their clinical practice? Is ultimately patient health improving? And I agree with you, Andreas, there's no one metric that can capture that, and it is very difficult. But I think it's really important for us as educational providers to measure these things, because if we're not doing that, we need to change what we're doing to keep evolving education to reach and engage and change clinical practice.
Yes, just to add my perspective, I find the keyword as relevant. So what is relevant for particular physician, and what could be relevant for one might not be relevant for the other one. So I think the trick here, how can we connect the right physician with the right learning content through the right channel? And of course, it's depending whether it's an IME, because in case, as Caroline suggested, Salesforce cannot be involved in CME dissemination. When it would be more a pharma company sponsored education event, and of course, customer-facing colleagues can be involved, so they can direct the right doctor to the right education content. Because in my experience, if physicians click on a certain portal 3 times, and 3 times they got relevant content, they will come back. And of course, we can measure how long they stayed, whether they click through the interactions, and maybe we can ask 1 or 2 questions at the end. But if all 3 times they click on irrelevant content, they will not come back. So I think here we have just 1 or 2 chances to succeed. And it is really, really important to direct the right physician to right content. And of course, the combination, if customer-facing representatives can follow up with physicians, if we can have the information who attended which session, and just ask 1 or 2 questions, whether have you learned anything? Have you changed your behavior? Because exactly, Andreas, as you said, the objective is not just to push some content, but to make sure that physicians will implement some of the learnings in their practice. And of course, Morse levels, as Caroline, you mentioned, is very important. We can track the participation, maybe we can track the knowledge, but very, very difficult to track whether they did anything different. I know some learning content, they have a question at the end. Please list 3 things you will do differently in the future. And if we can track that and come back to the same physician in 3 months' time and to ask them, look, this is what you have committed to, how are you doing? So maybe, we can at least see whether they made any commitments as a first step. And second, by following up, we can track whether it made any impact.
Very much like your aspect over there on that's the way we also think in the direction of what do you say called customer journeys, right? So it's not this individual touch point that you have and you run off and that's it, right? But really thinking it through, what can you do before, what do you want to do after, how do you want to measure the impact, and how can we across the different channels actually follow up, as exactly as said. So we have maybe our whatever webinar, internal event, whatever it is, right? So can we send afterwards medical, can we send the sales, or whatever it is, to ask questions of what the impact was and how they liked it and so on and so forth, to also get the insights back into the organization. I think we need to get better in that direction, not thinking about the event itself, but really think about it more holistically.
I have to say, I think I agree with everything that everybody said, but I would say understanding the behavior of the healthcare professional, not only when they're engaging with the activity, but as you've all described, there's a number of different channels that these materials can be provided. Each one has their own individual objective. And I think, the report also addresses what does the behavior of the modern day healthcare professional look like. So maybe it's time to segue to how we do that. And what we've called it is cutting through the noise. There's a plethora of information available to healthcare professionals for a variety of platforms, channels that are relevant to them, some less relevant potentially. And I think, what we tried to do with the report was address, well, how do we support a time poor healthcare professional? We certainly see with EPG Health on our platform, MedAuthority, the behavior of the healthcare professionals changed over even the last few years. The use of a mobile has increased significantly. We can see spikes during certain peak times in the day when they're engaging with those activities. And Andreas, to your point, it's not just a one-time exercise. They're going to be coming back to this routinely. And what some of the things in the report we've looked at is when does the healthcare professional tend to engage with medical information? And there's 2 out of 3 of them are accessing webinars, congress outputs, CME at home in their spare time. We see significant spikes with, and it shows in the report here, with podcasts. They're on the move. It's not surprising. That's when people listen to podcasts. So we need to make sure that the content, if we're going to get the impact, it's got to be made in a way that's accessible for a busy healthcare professional. We've got a list. We won't go into all of them today, but there's, we asked healthcare professionals what rate the demand for the type of content that they want to engage with. And I suppose it's not surprising that a huge number of healthcare professionals want that short form text and video content. And I think that, again, that's just the nature of what we're seeing with online behaviors, and healthcare professionals are no different. We can't be frightened of social media. It's there. It's a way of communicating. It's a way of letting healthcare professionals know that there is quality medical education available to them. And I think we've referenced Moores a couple of times here. And the first stage of learning for Moores is making healthcare professionals aware that there is a educational activity that might be relevant to their need. Social media is a platform to do that. And we need to make sure that we're providing good quality messaging around social media in order to do that. It's considered a very important channel for healthcare professionals when accessing content, and there's a big disconnect between that and what pharma are providing.
So moving on to just a few other data points, and then we'll kick it back to the panel. And again, all of the intricate data behind each of these callouts is available in the report. And Peter's already shared a link, and we'll be sharing a QR code and a link shortly. But sources, who do pharma who do healthcare professionals, and then correspondingly, who do pharma prioritize as far as sources of delivering information? And you all alluded to it in the previous discussion. There are different channels and different sources for each type of content that healthcare professionals may need to know. But on the whole, and this is a persistent gap in our doing this report every couple of years, doctors prefer independent sources. They find them more credible. They find them and it gets into everything: disease information, diagnosis information, accredited learning. We mentioned accreditation by definition can't come with sponsor influence into that material. It has to be independent. But of course, pharma and the response were very clear here, and I appreciate that. They put the priority on their own channels and on their own sources. And in my past experience, it's been interesting working for both independent and pharma-owned content sources and seeing that constant tension. And I don't have an answer or a solution other than, as some of you have said, meeting the right content to the right person through the right channel is imperative. And considering preferences, considering priorities, I think is a great thing to do, and is an important takeaway from this report. And then finally, before we kick it to the panel again for discussion, scientific meetings are a huge thing. Jonathan, if you go to the next slide. And clearly, COVID had a real impact on how healthcare professionals consumed those meetings, moving from in-person to virtual. And there is still a large demand for virtual meetings, although the going back to at least one in-person meeting per year has absolutely come back in. There's strong data about that. But that virtual access, it has not gone away. People are not, I'm done with Zoom. I don't care about those on-demand sessions or those kind of time-shifted sessions. No, healthcare professionals likely are attending more meetings than ever because they can go to that one key one in person and then get all that on-demand content for the hybrid or virtual meetings. And as far as industry support, service providers, there's data in the report on pharma support for virtual meetings and on-demand coverage, and service provider support is also quite high. So meetings is another huge thing to consider in delivering content, useful medical communications content to healthcare professionals.
Okay, so we've adapted in the report. We've identified the biggest delta between what healthcare professionals are demanding and what pharma are providing, and understanding that is going to help us cut through the noise and help healthcare professionals ultimately get quicker, faster, easier access to quality educational content that ultimately we hope, Andreas, to your point, will change behavior and improve patient outcomes. That's got to be the ambition for all of this. So I think, from a panel perspective, we'd love to hear, what some of the obstacles are that you've identified and perhaps some solutions of how we can close those gaps. Gabor, maybe we could start with you. You've been on both sides of the camp, so it'd be great to hear from you maybe first.
Yes. So when it comes to disease awareness, so there is always, discussion who should do disease awareness. Traditionally it should be the market leader, because if new patients are identified, new patients are diagnosed, of course, that that brand will benefit most, who's got, the biggest share. This is changing, however, because, more and more companies becoming more patient-centric, so it doesn't make a big difference that anyone can support disease awareness, because that's value to patients, that's value to the society as well. But I'm not surprised that physicians are much more eager to get support and communication here than pharma. When it comes to diagnosis information, it's the same story. If there is a product which is second or third line, that company will probably focus on the brand education, because by the time the patient gets the second and third line, it can take a couple of years. And again, whoever is in the first line treatment is more prioritizing diagnosis information. CME and independent medication, I leave it to Caroline to comment. Scientific meetings, especially in my previous role, it was really appreciated to provide conference summaries, scientific data in a 5-minute, 10-minute abbreviation, and circulated to physicians who couldn't attend. So I think what is a big change, and Andreas, I really like your comment, how to put different contents into a digital content journey across the year, even integrating customer-facing teams. So how from a conference can we provide information to physicians who didn't attend the conference, or attend but not particular session? So I think that's something which should have much more focus in the future, because that is irrespective whether it's an in-person event, whether it's a virtual event. If I didn't attend the conference, if I can get a snapshot from a session which is relevant for me, and here comes back again, if my sales rep will understand, what do I do and what is relevant for me, they can direct me to the right session. So that's from my end. And Andreas, maybe you can comment on that.
Yeah, thanks, Gabo. So maybe just to make a more general statement, right? So talking about the difference and what are the obstacles. I mean, for me, it really starts with truly listening, right? Because I think it's too often that we generate those reports like you guys just did, right? And then we acknowledge that there is a difference, and then we kind of close the report and go back to business. I think that is what's usually happening, right? I mean, let's be honest around that. So and I think we need to ask the question more often, based on those reports, based on the customer feedback we get, what should we start, what should we continue, and what should we stop doing, right? So that is, I think, one of the big obstacles that we need to address. We also need to be truly multi-channel, I would say, right? So there was this, I think, Ben or Jonathan, you made the statement around, a third-party platform versus farmer-sponsored platforms and all that. I think they all have their pros and cons. But at the end, if we truly believe and we need to meet the customers where they are, we need to invest into all those directions at the end, right? So again, come back to my topic around customer journey, that we need to connect the dots between the different channels that we have, and really making sure that we serve the customers, right? And again, provide the content that they really need at any point of time. Caroline, any thoughts on your side?
Oh, yeah, absolutely. I mean, Gabo and Andreas completely agree with you. I was just jotting notes as we were presenting this slide. The obstacles from my perspective, because when we spend a lot of our time monitoring healthcare behavior and their gaps and their needs, the biggest obstacles to closing the gaps, cutting through the noise is, as you alluded to, there's no time. Recent reports from Springer Nature show that doctors have maximum an hour a day to educate themselves. I know this will vary across specialities and regions, but time is so limited, and there's also a lot of content out there. So one of the biggest challenges is to, as Andreas, as you were sort of saying, you really need to find out where doctors are and provide them content where they're looking for it, which is where social media can come in. So yeah, obstacles, no time, many platforms, lots of different education out there, and diverse needs. There's no one size fits all, even within specialties. So podcasts are not going to solve everyone's needs. Webinars there's lots of different formats, and one of them isn't going to fix everything. So lots of diversity and an overwhelming amount of content. What are the solutions? As we talked to, I think some of the information on this slide, I think, gives us what we need. We really need to reach doctors through the channels that they are using. Social media has become a big part of this. Sometimes 2/3 of the traffic to our educational programs comes from social media. Doctors are on their phones, like at home or when they're on the move, asking them what they need. If really, doctors will engage with content when it's something that they want to learn. So I think we really need to keep on asking doctors what they want to learn, where are their gaps, and what formats they need, so that we can provide it in that format. And I think some of the successes we've had are knowing that there is no one size fits all, and it is actually providing education in multiple formats. So I agree with what you were saying earlier. In-person conferences still really popular, but let's face it, not everyone's got the budget to attend. We've just done a really successful program in thyroid cancer where we did an on-site symposium, but then it was also live streamed to the at-home audience, but then chapterized, put on demand. And then we did subsequent content based on the questions that came out of that symposium. So based on the real life needs from the attendees, we did more bite-sized content, more sort of snackable content to really embed the learning. So yeah, lots of challenges, but if we really listen to doctors, then there are solutions to bridging those gaps.
Right.
That's great.
I'm going to take that snackable content. We're going to have that one. That's I like that. Sounds like a great initiative. Sorry, Andrew.
John, if you don't mind, one more statement, because there's also a topic I'm personally quite passionate around, is that at one point, I know is maybe a little bit idealistic, right? But we need to stop putting people into boxes, right? So it sometimes drives me crazy to believe we have a certain specialty, and because they are sitting in this specialty, they're all like CME, or they're sitting in that specialty, and they're therefore all like face-to-face, or they're all like this type of content, and they're all like that type of content. But when are we really able to come to a point to treat the HCPs or the patients as individuals, as human, and say we have a good understanding of their individual needs and their reality, and we can actually serve that, right? I know it's a little bit futuristic, and we are not there yet from a data perspective and all that, but I think that is really the future where we should that we should aspire, I would say.
Well, Andreas, just wanted to comment on that, because I spent over 20 years in meeting a number of different physicians. There is one which is super common, that all of them, they see 10, 20 patients a day. And what is on top of their mind, how are we going to diagnose people? How can I solve their problem? So they need solutions to problems that they turn up in the morning in the hospital, and they don't exactly know what kind of problems they will face. So whatever we provide to them, and this is again coming back to the customer-facing team, they might be the right people to figure out what kind of solutions they need and what kind of content is most relevant to that particular physician. So exactly as you said, we should treat each individual in a slightly different way, making sure connecting them with the right content at the right time and the right channel. So whenever a particular problem turns up for the physician today, they know where to go and they can easily access stuff. And I think one of the slides also explained the importance of downloadable content. So how can they download stuff that they can take home or even use in the patient discussion? So for example, I know some companies produce great patient journey maps that are downloadable. So physicians can explain to the patients, this is where you are, this is what you can expect, this is what could happen to you, and this is how certain problems can be solved by healthcare system, how certain problems can be solved by patient advocacy groups, and how certain problems can be solved by some of the pharma companies.
Yeah, great. Thank you. Thank you, Gabor. And I'm delighted to say there will be a slide with a bit of information on downloadable content and the demand for it later on. So thank you. And yeah, I think, there's a comment in the chat from Carol, and you're right. Let's not put all the focus on social media. And that's certainly not the intention here, but it's one of the things where there's the biggest gap between what healthcare professionals find acceptable and would like receive information from what pharma provided, but it's certainly not the only channel, far from it. And we see a different engagement index from social than we would do from email or referral, but it's certainly got to be considered as part of that plan and strategy to cut through the noise for the healthcare professional, to let them know of the activities available. So if there's no further comments on this particular slide, I think we actually thought right now, there's been a few of you asking for links to the report. We're going to do something that I think we're always told not to do during a presentation, but we're going to give it a go. You can access the QR code here. That'll take you straight to the link. So please don't all go leaving, but it's there, but there will be a link made available. It's in the chat again. Yeah, the report's definitely available. And yeah, we'd love you all to download it and get your feedback. So moving on to the next section is we're going to look, how do we actually measure this impact? So we've cut through the noise. The healthcare professionals are aware of the activity. How do we measure that impact? What is it that we can do? And how do we go about doing that? So I think the first thing, and we've mentioned it a couple of times, certainly Gabor and Andreas have heard you both mention this, and I think there's a bit in the chat as well. This is part of a multi-channel campaign. We're not just saying online is that solution. There's a lot of, and Gabor, you've mentioned sales reps, MSLs, all the different activities there too. And I think, Andreas, to your point, the journey, joining the dots. This is a multi-channel campaign. A lot of people we're talking to have the aspiration, some are perhaps are achieving it, of omni-channel. But of that multi-channel campaign, each one of those channels is relevant, is important, but the objective and the expected outcome can be different. And I think it's really important to understand what that is. And each channel you need to consider the type, the format, the source of that channel. And they're all important factors to consider about that. What can be the impact of what we're communicating, of what we're educating here, and what would the healthcare professional find palatable? Now, the key things the report identified, if we are thinking about these multi-channel campaigns, what are the fundamentals we need to consider to make sure that healthcare professionals are going to find it, Gabor, to the point you made right at the beginning, it's a relevant experience. I want to land on something that is relevant to me. And I think the next phase to relevancy is the personalization that everyone's touched on. But unless we get it relevant, that first experience, it's going to be poor. And I think you made the point again, Gabor, they won't come back. So it's got to be, first of all, though, easy to find. You know, there is so much information out there. It's got to be easy to find. It's got to be easy to consume. I think the stats may have changed now, but I think on a mobile, you get 3 scrolls before you have to hit the meaningful content. Otherwise, they're going to leave. So it's got to be easy to consume once they've arrived at that destination. And unsurprisingly, it has to be credible. I think there was something in the chat about credibility of content. It's got to be credible for the healthcare professional. It needs to know where the data was funded, the information, the references, can they trust it? And this is where the channel strategy is so important. What type of content are we hosting on what channel to make sure it's credible and trusted, and it's clear of that information. I think we've touched on virtual access. We see a massive demand on authorities, certainly for virtual access to Congress for those that can or can't attend. And Gabor, there it is, the downloadable content. Every year we do this report, or every couple of years. Michelle couldn't do it every year, but it's always there. It's always, I think it's number 3 on the list for content. They want the downloadable content. It's not surprising. They're busy. I'll download it. I'll have a look at that later, or I'll share it. They have the, and that's just meeting this multimodal requirement of educational content. You know, not everybody is going to have the time to read online, and others, I still like to print out things, you know, so you know, it's always there, even in this digital age. Now, understanding the channels, how do we then start to put that into medical education and meaningful medical education that gets impact? Well, I think certainly from our experience, and it'd be great to hear, Caroline, from your experience of IME, but it's got to be considered as part of a cycle. So absolutely online, we need engagement metrics, and those engagement metrics need to be more than session time, need to be more than page views. Google don't use those for a reason. It's because they don't demonstrate engagement with the content. So there are things we can do online that show engagement. Scroll depth. Have they actually played the video, and how far through the video have they got? Have they downloaded the content? Have they bookmarked the page? That shows an intent to learn. These are the kind of engagement metrics that we can start to put, not as a single metric, but as a group of metrics that show engagement and active learning with the content, active engagement with the content. We can have impact outcomes. And I think a lot of people are doing this. You know, Caroline, you mentioned right at the beginning the importance of MORES, the pre and post, the knowledge gain, the competency, the pre and post surveys that we can now host online mean, you know, we can test somebody before the learning and after the learning, and have we seen a change? So all these bits of information, once we've got that, then overlaying that with the engagement metrics, we can then begin to form an outcome assessment. What is the outcome of that time spent within the learning environment and the impact of that learning? And we can have a look at what the outcomes were for the healthcare professionals. And then we can identify, have we addressed the educational need? Is there an ongoing educational need? And then we can evolve that needs assessment. We can have another look at that needs assessment. And are the learning objectives that we've identified still accurate against the needs that we've identified for those healthcare professionals? But so what? So we've got all that information. So what? This is the personalization bit. This is the bit that a modern day digitally native healthcare professional expects. I expect to then be told to the next most relevant content based on my personalized need. And this is the bit, I think, that where we can perhaps start to push the needle for a digital experience of educational content. And we need to be asking ourselves, so what? And I think it's got to be down to the relevancy of that content and the personalization of that learning experience. And there's a plethora of content out there. And when we're looking at our platforms, we need to make sure that that content is designed for the different persona types. There might be a different requirement for the specialist than the generalist. There might be a greater engagement around a certain content type than others. And that's the kind of information that we can really get into nowadays with digital learning. And then we've got continuous medical education, because that means we're able to understand the behaviors of those healthcare professionals. If we go back to addressing that number one strategic priority for the pharma have decided is understanding the behavior and the insight, that means we can begin to understand that, and we can begin to evolve not only the needs assessment, but the educational design of the programs we're doing, and considering the content validity of is it still accurate? Is it still up to date? Is it still relevant? So I think this cycle will mean that we're able to continue to provide relevancy and personalization. And as such, we've created a framework based on MORES, which we're just going to touch on today because it's a lot of detail, but we've created an impact outcomes framework. It's been adapted from the MORES level outcome assessment, the conceptual framework developed in 2009. That conceptual framework has been the gold standard, but it was designed for a physical setting. It wasn't designed to monitor digital learning. So what we've done is we've created a framework that will enable us to create 5 stages of learning. That means a healthcare professional can demonstrate meaningful engagement within an online activity. We've not gone into the detail of how we're doing this right now, but we'd love to share it with you. But we're going to, in the same way MORES established 5 stages of learning, which is I've identified I've got an educational need and this activity might be relevant to me, right to learning stage 3, which is where I've committed to that learning. And we're seeing over an hour of engagement, active engagement with educational content online with learners that are getting, or healthcare professionals getting to stage 3. Stage 4 is I'm going to give you some feedback. I like this. This is good. I've identified that I've actually demonstrated some knowledge gain, some competency. And level 5 is to that point, Gabor, of let's follow up. Let's follow up 3 months, 6 months, 9 months. Have you actually put it into clinical practice? And these are the questions we're now asking healthcare professionals in a digital world. So to align it to the MORES outcome assessment, impact outcome 1, it's participation. Doesn't tell us anything. Doesn't tell us anything. It's just, but to your point, Caroline, we've got the right people from the right geolocations. Tick, 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 good, but it's a participation. Then, but if they go through those learning stages, if they've committed to the learning, we can then assess them confidently with pre and post surveys, and we can get confidence. We're not asking satisfaction, because online satisfaction has a completely different context. But let's ask them about the confidence of that learning, the knowledge gain, pre and post scores. Let's just align to the learn objectives. Have we addressed the educational need? Now, once you've got those two pieces of information, confidence and knowledge, you can calibrate that. And then we can start to identify personalized, relevant content that is going to be required for that calibrated learning. Competence. Do you actually feel more confident to go away and treat, and do you intend to go and put it into your clinical practice? And the final one is impact outcome 5, as we call it, and that's have you put it into your clinical practice? And let's have an interview. Let's meet with the healthcare professional to discuss how you've gone away and put it into clinical practice. So this is hopefully one example of what we can now do online with educational learning to look at not only the outcome, but I think moving towards the impact and understanding the behaviors online of healthcare professionals. Knowing the journey through those stages of learning, we can see their behavior through the content and how they've come back and the number of sessions they've had, because they will need more than one session. Healthcare professionals don't sit down on a desktop for an hour and take part in an educational learning. They will dip into it, the 10-minute, 15-minute sessions.
I didn't catch that.
Oh, and my phone is doing. So that was Siri. Sorry, I don't know why that keeps going on. So I think it's possible now to have this continuous cycle and to have this learning experience and put the insight and the behavior of the healthcare professional into online learning. So that leads us on to, we did ask in the report, what proportion of healthcare professional activities include measurements, and what should we include? And I think, it'd be great to round this conversation off with your perspective from a panel in terms of what should we do differently, and how can we measure impact, and perhaps some of your experience as well. Caroline, I know from an IME perspective you've talked about more, so it'd be great to hear from you here.
Yes, so well, thanks, Jonathan. Yeah, I think the way that we really, well, what's become very apparent to us is how we need to support our supporters, but IME is really, everyone wants outcomes. We want outcomes, the supporters want outcomes. So it's really about engagement. It's about finding out, doing robust, I mean, if there's RFPs, for example, for IB programs, often the funders will, put information out there about how they want outcomes to be measured. That's really, really helpful. But how we like to do it is really talk to the audience first. If we want impact, we need engagement. If we're going to get engagement, we really need to speak to the experts first. Like, what are the gaps? And it is going to be an evolution. What are the gaps? What does quality engagement, what does quality content look like, and develop it like that? Definitely, we need very strong outcomes measures to, like you say, that the pre and post, the post education interviews, and really evolve that learning. So it's really making sure that, I don't think the knowledge gap will ever be completely closed. I often use the analogy of like you're chipping away at something. Medical knowledge evolves constantly, so it's about measuring the impacts, but then measuring the continuous needs. After you've actually improved clinical practice, what next? What do we need to do next to keep experts in the loop, to keep evolving clinical practice? So I think that involves lots of strong communication, strong measurements, strong quality content.
Thank you, Caroline. A little bit quiet there, but I think I certainly got most of it. So thank you.
Sorry.
And Andreas, how about from your perspective, from a pharma perspective, what sort of impacts are you hoping we can measure with educational content?
Yeah, so again, speaking from a pharma perspective, right? So I mean, we always have our strategic objectives that we're trying to deliver, right? So which then we usually translate into strategic imperatives, which you then translate into communication objectives, which you then translate to material development, target audience identification, and so on and so forth, right? So at the very end, whatever the outcome is ultimately delivered by us in pharma or by third-party providers needs to link us back to our strategic objective. So has it moved the needle on our strategic objective, on our strategic imperative? That's what it's all, what is interesting for us, to be honest, right? And again, that's the difficult part to really measure.
Yeah.
But coming back to your question, I mean, when looking into the future and see your report coming out in 2 years or so, another update of this report, I mean, ideally, we would have flipped this chart upside down. I mean, that's what we should aim for.
Yeah.
Right. So at the end, that exactly what the KPIs around numbers and all that is sitting on the bottom, but impact is really on top. And that's what we should all aim for, I believe. At the very end, I also quite interested to connect data points, right? So I get your funnel, and I really like the approach here because it's much more impact oriented, I would say. But the question for me is also, can we actually measure it with real clinical impact and clinical outcome? Right. So it's one thing, of course, to have the interview and saying, clinicians what they actually change in their clinical practice. It's another thing to see, has the clinical practice changed in reality?
Yeah.
Right. And do more patient benefit from a different type of treatment or from a different diagnostics or whatever it is. So can we actually take it even one step further and really connecting that to change in clinical practice?
Well, Andreas, you brought a completely different dimension because, before setting the strategic objectives, we need to figure out what patients actually need, because very often I observe physicians are very much focused on the clinical parameters, on the biomarkers and the lab tests, whereas patients have a range of different problems on top of that. So that should be and could be actually included in the learning objectives as well. But going back to the measurement point of view, in my previous life, I had the pleasure to work on medical education content. Very often the appetite from pharma to assign budgets and resources to measuring was very limited. There was much more focus on the learning content and getting everything approved. But just to identify 10 physicians with whom we would conduct an interview, never mind before, but even after the learning experience, let's say 2 days before the learning experience, and speak to the same doctor 2 weeks later, just to measure whether any learning stick to them, whether is it something they implemented in the real life, that would be really, really beneficial. And you're right, on this chart, you see competence, whether do they have the knowledge, and the next step, whether can they apply it in the real world, and what are the barriers, if there are any. And ideally, it would be the 6th dimension, what is the impact on the patient? But that would be even more difficult to measure. So, well, the desire, I would say there should be a desire. And I was practically almost shocked when I saw the report that 50% of people are not even aware of what more levels are. So never mind whether you have the EPG model or you have the MORE model, if people are not even aware of that what you could measure or should measure, then we have a problem here.
Yeah, that's a great point, Gabor. And one of the responses in our survey was that doctors are very willing to participate in this kind of question and answer. I think half of them said they do it regularly. So this is something we should really consider in education, which I think really, in a sense, taking points from all your discussions, it kind of closes the loop that if we're doing great education, we should be getting great feedback. And that great feedback should allow us to make even better education. This ultimately, I hope, sort of to Jonathan's continuous medical education slide, forms a virtuous cycle, and that we're constantly just building better and better and more impactful and more well-received, giving us even better feedback. And related to that, a key thing here, and it was a great comment that came out in last week's European CME Forum, we need to align all this to doctor behavior. And there was an interesting debate there, and it kind of gets to some of the questions running through the chat related to compliance and accreditation. Some of these schemes, be it compliance schemes, which we have to adhere to, and accreditation schemes, they sort of dictate how doctors should learn, which isn't always the most useful. So, because we want to align it to how doctors actually behave, not just sit here for an hour and watch these slides and answer some questions. It doesn't really match behavior, but micro learning, on the move learning. And this gets to the idea of, partial credits and everything else. And in a sense as well, with all of this, trying to address one of the questions, we need to remain compliant. We need to assure that, funders and relationships and directions and goals and learning objectives are all being put forward in a transparent way, that doctors know what they're getting and then can trust the independence and the credibility of, if it's independent content, or can appreciate the sponsor's intent behind sponsored and so-called by the ABPI code at least promotional content. So really great points, everyone, and just wanted to both address some of those questions and point to this other finding that doctors do seem from the report that doctors do seem very willing to participate in this kind of back and forth.
Yeah, sorry, Andres.
I just want to say, I think it's a great point, right? So I think the entire healthcare ecosystem needs to evolve, right? So it's not only the providers, not only farmers, also the regulators, also those that that actually also give the credits at the end. So all of them need to evolve further and really accept the reality that the reality has evolved, I would say, right? And I also agree with your point, Gabor, that you made earlier around, we need to put our money where the mouth is, right? So really making sure, not saying that, oh yeah, customer centricity or patient centricity is key, but really invest into that, right? So one of the key aspects of my team is, for example, we are driven by customer experience. That's our ultimate outcome, so to say, within the medical space, right? That's part of my team's vision. And but this is also something that has been quite new to the medical space and is something that is also evolving further over the next years, right? So we do some movements in that direction, but yeah, you're absolutely right. It's not only about lip service, but really investing into those areas.
Yeah, absolutely. I think I've seen Peter, you put in a chat with 2 minutes left. So I just think, I love the idea of flipping that graph that's on the slide right now and perhaps revisiting that in 18 months, 2 years time, see if we've changed that needle with the investment people have made. I think Ben and I attended the European CME Forum last week, and we were talking about, can we challenge ourselves to get Moore's level 6 and 7? Really, can we demonstrate, to your points, Gabor and Andreas, have we impacted on that patient community? Can we do that? How can we do that online? How do we do that? And it'd be really exciting over the coming months and years to explore how that's possible. I've seen there's a couple of questions in the chat, one of them about content. And actually, Ben, I wondered if that's something, obviously, as the head of science and content creation on MedAuthority, I wondered if that's something. I think the question is, you found the right channel, but the content was lacking. And I guess that comes back to that relevancy and the trust and credibility.
Mm-hmm. Yeah, and perhaps real quick before Peter kind of jumps on for the tail end of this excellent session, I really appreciated. You do need to produce the best content, and whether it's excellent writers who really know their thing, whether it's patient input that's helping you tailor it so the doctors better understand what the patient needs. There's so many avenues for that, but excellent in understanding the science and excellence in writing is really a foundation that really gets to the heart of this whole medical communications work that we're all very interested in, I would say.
Yeah, the report will address the content type, the formats that healthcare professionals most want, but yeah, content's king. Get it right. Okay, so Peter, I think that takes us to the end. There's a final slide with our QR code again.
Thanks, guys. Thanks. Guys, I'm sorry, we are going to have to draw a line there. So I'm sorry, I'm looking a bit twitchy. I want to jump in now and say thank you, huge thank you. Just lose the slide for a minute. I think everyone's got that now, and we'll just wrap up if that's okay. People who watch these things regularly will be probably aware that I'm sitting here very frustrated because I wanted to argue with you quite a lot on some of those points. We covered a lot of ground. I always say when we look at a report like this, people should download the report and think about the data and not take it absolutely as read. Use it to argue and think about what you're doing and so on, because it is just a snapshot. And I think we could look at a report like that. I mean, there's a couple of things that jumped out at me. I was going to throw in. You've all talked about Moore's laws and measuring, which is so important. I've got a background on the CME side. I set up the European CME Forum with Eugene. I'm not involved anymore, but I quite feel very strongly about measuring outcomes and so on. It's very difficult to do, but there's a table in your report which shows that almost nobody in pharma and the service providing side even knows about Moore's, let alone sort of thinks about it, sort of thing. And you've sort of got to think about this stuff before you can then argue the whatever over quite how you do it. And the other thing that again just jumped out to me, I saw someone mentioned it on LinkedIn as well, which drew my attention to it. Over 50% of doctors using TikTok every day to get scientific information. And I just think that's the sort of thing that you look at and you go, hang on a second, if people think about this data and use it to talk amongst themselves and challenge themselves and challenge what they're doing with their projects, then I think we're doing something useful. So I love it. I would encourage anyone to download that report. We've provided the link, and as I say, look at it. There's a lot of data in there, and there's a lot that you can chew over and discuss. I know everybody online is very happy to be contacted. LinkedIn is an easy way of doing it. So please, anyone who's watching today or coming and watching the recording later on, please do follow up and keep these discussions going. It's so important to understand what we're doing and to measure what we're doing and think about it, but it can be very, very difficult to hit those sort of top levels for MOREs or something, in terms of patient outcomes and so on. It's very, very difficult and resource intensive, but at least go somewhere down the line beyond measuring how many people are sitting in a room sort of listening to your presentation. Okay, I'm going to draw the line there. I'm going to ask everyone to give us a little wave as I stop the recording. Anything that I'm doing, medcommsnetworking.com, as I say, reach out to these guys and read that report. But just for today, I'm going to draw the recording to an end and say goodbye.